I chose ophthalmology because it allows me to see people of all different ages and to combine both medicine and surgery into treatment approaches. I'm Dr. Mary Jo Oyen. I'm an ophthalmologist at the Eye Center here at Southwest Health. I grew up in Platteville, Wisconsin. This is my hometown, and I lived here and went through school here, all the way through high school and through college. I took a slightly different career path. I went through mechanical engineering here at UW-Platteville. I worked 6 years as an engineer at both Procter & Gamble in Green Bay and then at Oscar Mayer in Madison. I went back to medical school when I had 3 kids. Daniel was 5 years old, Stephen 2, and Brian was 6 months old when I went back to medical school at UW-Madison. And then I had our last child, Sarah, in medical school. And so that was a little different career path than most. It was a little bit of a deviation, but it worked out well in the end. I met my husband when I was actually still in high school, so I wanted to finish school early. So I steered away from medicine originally and went through engineering. But after a couple of years working, I felt that it was best to go back to what my heart was really in, was medicine. My personal philosophy of care is to treat each patient individually, to maximize what I can for their vision so that their quality of life is better. Given that we can't fix everything, like if a patient has cataracts and macular degeneration, we may take the cataracts out just to improve their overall vision so they can stay independent. We may not be able to correct them back to 20/20, but it will be a better vision than what they have without it. And I try to treat each person as an individual, as if they were my mother, father, sister, or brother, and do the best job I can for them. I've had the opportunity to do 6 foreign medical mission trips. The first one was to Madurai, India, where I worked at Aravind Eye Hospital. They saw 80,000 patients a week and did over 500 surgeries. That was a real eye-opening experience. I then went to the Philippines and operated on the Flying Hospital, Operation Blessing, and that was also a very humbling experience, actually. We set up a operating room in an old ER and made it function. Conditions weren't ideal, but they were workable. We saw about 700 patients and were able to do about 100 eye surgeries during that week. And the conditions were challenging. It was 100 and some in the operating room because we didn't have temperature control like here. I do a variety of different surgeries. Cataract surgery is probably the main surgery that I do. There are several different types of options now in cataract surgery. The toric lenses are quite good and can correct a person's astigmatism so they don't need to wear glasses or be as dependent on them after surgery. I also do eyelid surgeries, whether they be droopy eyelids or turned in or turned out eyelids, which are entropion or ectropion. I like doing refractive surgery, and I used to do it for about 18 years. I was drawn back to Platteville as it's my hometown. I've seen Southwest Health grow in the years that I've been here, and it's been impressive with our leadership now. I like to be part of a team that allows me to do or provide the best care that I can.